They're not. It's just to give you an idea of kind of what's out there in the region. So my name is Tim Baker, and I am Assistant Chief with Fort Carson. And see, I've been doing that for about 21 years, almost 22 years now. And I really like it. And I started getting into the triage stuff back in 2009. Started getting into it pretty heavy because, well, let's just say we all suck at it because we just don't get the experience of doing it until a catastrophic event happens, and then everyone's like, oh my God, what do we do? So I kind of took it on to try to get information out there to people to, hopefully it's not that big of a cluster when the event actually happens, and there's some smoothness to it in the chaos, all right? So, having said that, everyone here, try to get to know y'all a little bit better. Nurses, staff, nurse, staff. Okay. Respiratory?
CNA.
CNA? EMT?
Exercise physiologist.
Cool.
I got a smattering of everybody.
Okay. All right, so EMT, some field experience. How many other people have some field experience? A little bit?
I was
A
a
lot?
medic for 21 years.
Oh, there you go. See? So you definitely are going to kill people, just the way it works.
Oh, I know.
You have way too much knowledge.
I know.
EMT and below, you're safe. You're good. That's the way it works. The more education you have in these things, the more you want to treat. And that's the biggest problem people have in mass casualty incidents is they want to treat everyone. If you had enough people and resources to treat everyone, you're not in a mass casualty. Does that make sense to everybody? So you have to triage, you have to prioritize, right? Good old French word of triage. Prioritize, okay? So, some people might have to be written off. I know it sucks to hear. You might have to look at someone and say, this person's going to die, I'm going to move on to someone I can actually help. That's going to be a hard thing for people to swallow. It really is. All right, especially that little 6-month-old baby. I'm going worst case scenario there, I know. 6-month-old baby, agonal breaths, in the middle of a mass casualty. I'm sorry, I can't do anything for you. And you have to be able to write them off. It sucks. But that's what mass casualty is. It's having to make those hard choices. So we have a system to help you make that clean-cut delineation between who's priority and who's not. Okay, and that's where the triage systems come in. All right? So, here recently, they changed from start triage to ramp. Have we heard this yet? No? So, all the physician advisors for the region had a meeting about a month ago, and they voted on whether or not to change the standard triaging for this region. And they decided to go to ramp. All right? I'm not that familiar with it. I'm still learning myself because there's not a lot of information out there. So a lot of it is new. It's simplified even more than start triage. We'll get into start triage a little bit because you're probably going to see a lot of that until ramp starts getting taught more. All right, and I'll probably be one of those people teaching it more once I get a better understanding of it, so I'm not teaching bad information. All right, so we are going to go kind of a down and dirty triage. That way there's not too much confusion between start and ramp. I don't want to get too specific on start, but some basic triage principles, and then from there we're going to practice a little bit. Okay, so I got you for about an hour and a half, and so we'll make sure you guys get some kind of hands-on to practice a little bit of going through the motion of how to triage. Okay, so some of the main things, I have all kinds of examples of the different triage tags out there. Okay, all these different triage tags. Carbon copies, laminated, not laminated, stickers. These are cool ones. These are a combination, laminated and stickers. These are the ones we're carrying now. Slap bracelets. All right? Flagging, right? Markers, pencils, whatever it is, you can triage with. It doesn't matter, it's whatever your system is, okay? So do we have a determined system for this hospital of how you're marking patients besides?
We have the laminated cards.
You're going laminated cards. Okay. Are they like these ones?
Yes.
Okay. Figured it. 9 out of 10, I got one of your cards here. But here's the thing: does it really matter that you have a triage tag on them? Anybody? Does it really matter?
No.
No. Is it a priority to fill one out?
No.
No. It's not gonna stop someone from helping them because they don't have a triage tag. All right. Is that permanent? Sharpie, permanent marker.
Yeah, hold on.
See?
I just realized, I was like, all right.
Why?
You have a better eye than I.
Ah.
I think she's
You
right.
figure you teach long enough, pretty soon you start catching that.
I think that's
I think it's just a highlighter. I don't even know what that is.
I think it's probably a disinfectant spray.
Yeah, it's a disinfectant spray. Okay.
There is not a trace.
Oh, well, never mind. You're going to use your imaginations. All right. So, having said that, triage, filling out these things is not a priority. It truly is not a priority, okay? Because I can move a patient into an area and say, grab them first. No markings whatsoever. The patients are over there, they know where to go, they know where the priority patients are. So everything from that system on is just adding to it, whatever your system is that works for you, okay? So, whatever you mark them with, and the reason I said like pens, markers, because what are your different basic triage categories right now? What colors? Red, black, green, yellow. Okay. So, which one's the worst?
No, I thought it was red.
Red. Black patients. Are,
They're good.
they're good. They take absolutely no resources whatsoever. They're done. Okay? Remember, this is mass casualty. They're dead.
Yeah,
They're good. Okay? I'm moving on. Red patients are your priority. Those are your worst patients because they are going to take your most resources. Everything in triage is about resources. How many resources do I have on scene? That's why I'm in a mass casualty, because I got more patients than resources. Okay? Which patients are the priority that are going to take the majority of my resources to deal with? All right? In Start Triage, you have yellow, right? You have delayed. All right? What's the difference between a yellow and a green patient? There's one difference,
Walking and walking.
right? Ambulatory, not ambulatory, walking, not walking. Can move under their own power, they can't. Okay? Yellows are stable patients. So many times people are like, oh, they have, they went unconscious for a second, they said they did, they said they're having a hard time breathing with it, they're yellow. Because they're not green, they're a little bit higher priority. That's not how this works. Can you move or not move? You can move, get over there, green, as long as they got the rest of the stuff covered, okay? It's that simple, all right? So, red, what do you think we're looking at to make them a red category? Anybody remember?
Breathing right now.
Breathing?
What they're bleeding.
Okay, what type of bleeding?
What foods? Let me get the word out, right? Heavy bleeding.
Heavy bleeding? Yeah, arterial spurting.
Yeah,
But if I throw a tourniquet on them, just stop that.
maybe.
Is that an issue anymore?
No.
No. So
Is it internal?
bleeding does not matter.
Is it internal bleeding?
Don't even care about that.
Unconscious.
Conscious is another one. Conscious or not conscious? Because if they're conscious,
They
or
might go yellow.
maybe if they're unconscious,
They're
right? Guaranteed they're going to be red.
Maybe.
I can't assess your mentation, so I have no idea. You're automatically red, right? Then are you breathing or not breathing? Are you a black or a red, right? So, but yeah. So breathing. What do we care on not necessarily bleeding, but circulation? What do we care? Heartbeat, pulse, yes or no? That's it. Not cap refill, Not any other, well, they're pale, not pale, bluish. Do they have a pulse, yes or no? All right, now what type of pulse are we looking for? All right, if we go distal and they have a pulse, how good of a perfusion do they have going right now if they have a distal pulse? Right? So that's my good assessment. That's my down and dirty field assessment of their circulatory system. You have a distal pulse? Yeah? You're good. Can you walk or not walk? Right? All right, so if I come up to you right now and I say, hey, can I check your pulse real quick? Did she follow simple command?
Yes.
Yeah, didn't she? She breathing? Yep. And she's got a distal pulse. Ma'am, can you go walk over there?
I sure can.
Ma'am, what color would she be?
Green.
How long did that take me?
Less than 30 seconds.
10 seconds tops? Mostly because I was talking to y'all while I was doing it. I can go through patients quick if I know what I'm looking for. Bam. But really the goal that we're looking for all these patients, 60 seconds. Okay, 60 seconds per patient with treatments. If you are doing in treatments, that's your goal. That's the kind of thing you're looking for. Because if you're by yourself and you have 60 patients and you're spending a minute per patient, right? Now what time frame are we at with that?
An hour.
I'm at an hour into this. I'm still trying to get through triage. Okay, so you can see mass casualty, I gotta be down and dirty, I gotta be simple, I gotta be cutthroat. I gotta find out what they have, bam, label them, and I'm moving on. All right, so treatments, what kind of treatments? We kind of talked about one. I'll throw a tourniquet on you, or hold your own pressure. Hey, see that? Hold that there, don't let go.
Simple adjustment to see if they breathe.
Right, and adjustment if they're not breathing. Not necessarily treatment, but a repositioning to see if they spontaneously start breathing on their own, right? And they start breathing, what color are they? Red, because they're unconscious, but breathing. You're red, bam. They're not breathing after you reposition. Sorry, right? You're either dead now or you're expected to be dead. I gotta move on, okay? So, we got that. What other treatments do you think we can do that simple, that dirty, that quick? What about a chest seal? If you got one of those rapid chest seals,
We don't teach them.
you don't go into that? Okay. See, tourniquets, we got that. Let's see here. What else would be in y'all's brief? OPA. Okay, we could throw an OPA in there. Yes, no?
Since we have a lot of non-clinicals too, I think we pretty much just stick with tourniquet and maybe a duo-dote if they're handed out.
Okay.
Ours is very simple.
It's always weird where the levels are
Yeah.
everywhere you go. So, okay, but bare minimum, right? You can throw on a tourniquet, and if they're assessing their breathing, okay, bare minimum, at least you can do that. Even with minimal supplies, you got Curlex, you can make a tourniquet, right? Piece of cloth, you can make a tourniquet, right? Stuff that doesn't expire. That's the beautiful thing about a lot of this triage stuff is stuff doesn't expire. So many times, I can't tell you how many times I see someone's mass casualty, like cash, and it's IV supplies, O2 this, O2 that, there's like this endless thing of burned gauze and all this stuff, and it's like, all this stuff's expiring within 2 years, and you have to replenish all this. And you constantly have to check the expirations. Or you can just throw a bunch of Curlex in there, tourniquets, stuff that doesn't expire, all right? Coban, everybody's got that stuff. Doesn't expire, and it's all ready for you. Because what do you think the number one injury is in a mass casualty?
Cuts, bruises, and breaks.
Yep, superficial trauma, right? So your number one life-saving step you're gonna do in a mass casualty is gonna be bleeding control. That's your number one. That's gonna save more lives than what you think, all right? Because you picture tornadoes, earthquakes, mass shootings, horrific car accidents with a bus full of nuns, hit the daycare, school bus right at 3 o'clock and everybody's trying to go home, and it's all going to be, the bleeding control is going to be your number one thing to save them, okay? So your stop the bleed techniques, do y'all teach that here? Stop the bleed? Okay. All that stuff's relevant, but can you be quick, okay? So 60 seconds per patient with treatment, tops, all right? How do I get rid of my greens immediately on a scene? What's the very first thing I need to do to get my greens out of there so I don't even have to worry about them? Right? Hey, you guys, get the hell over here and get away from there. Right? Bad over there, good over here. Get over there. Why are you still over there? Right? And a lot of times, people are going to be helping their friends. All right? That's going to be your other catch to that. They're not going to want to leave their friends and family. So use that to your advantage. Hey, you don't want leaving them? Then help them get over there. Right? Cool. Help them control that bleeding. Teach them what to do. Right? Here, tie this till the bleeding stops. Keep putting pressure until it stops. I can use people. I love using bystanders on the scene. Man, I've had them doing CPR for me. I've had them doing bleeding control. Man, I'm bouncing through cars on traffic accidents like, okay, they're ejected, you're working them, cool, you know CPR, keep doing that. One time I grabbed this older lady's hands and I started pushing forward. And I was like, keep doing that till I come back. She was like, okay. All right, use your bystanders. Use your green patients. They're willing to help, I guarantee it, they just need direction. They need someone to say, you, there, and do this. Don't make it complicated for them. Adrenaline flowing, motor skills start going out the window. Keep it simple for them, okay? But use them. All right, so you get your greens out of there. What do you technically, hypothetically, theoretically, what should be left on your scenes?
The
Reds, yellows, and black. Okay, so do we touch blacks? Do we move blacks? Do we do anything with them? No. They're evidence. That's a police matter. Coroner's got to deal with that. Sheriff's got to deal with that. FBI, whoever all is getting involved. ATF, Homeland Security, every other 3-letter acronym out there, right? Leave them be. When do we move them, though? When do you think we would say, we have to move them?
When we're patients underneath or to get.
They're in the way. They're in the way of what I need to do to get to save lives. Do we move them far? Just a little bit. Just enough. I got a path through this school bus of nuns. I'm going right through, okay? So, you got that, you move them, all right? We're dealing with that. So, what do you think my very first question is as I'm coming upon a patient? And what am I looking for? Conscious or not conscious, right?
For response.
Hey, okay, checking that mentation. She answers me, cool. What else am I looking for at the same time? Pulse. Right? And breathing rate. Is it fast, slow, is she breathing at all? Just something, give me some kind of indication of life, okay? Most of the time, they're gonna be breathing a little hard and heavy depending on the chaotic event, okay? Especially if they just got done running from an active shooter. Got it, you're gonna be breathing kind of hard. Half the time, people don't even know they got shot because their adrenaline's pumping so hard, they're just running, okay? So, take a second, look them up and down, and do that good initial assessment. It takes me just a couple seconds. I'm gonna see it as I'm walking up to them. I don't even have to wait till I get to them. I can label someone with a color code just coming up to them. Like, ooh, yeah, you're probably gonna be a red. Hey, and then I confirm it, okay? So, if you get into START, they are very specific about respirations, all right? 30, above or below, is their magic number. Is it pretty easy to assess someone at 30? Take a breath every second for me real quick. Go. Nope, that's not a breath every second. All right, it's going to be quick. That's pretty easy to see as I'm coming up on a patient. If I see that, then real quick, why are they breathing that hard? Did they just get done running? Cool. Okay, but if I'm coming up on them, they're laying on the ground and they're red. All right. Then there's the exact opposite. How slow are they breathing? Is it going to be that expectant? Am I going to label this person black? Okay. Little 6-month-old baby doing diagonal breaths, doing a breath 8 a minute. Is that good quality of life on that kid? No. Sorry, that sucks. If I could save them, I'm not in a mass casualty. Okay? So, you have to be cutthroat, okay? Simple, down and dirty, keep it that right there, okay? So, what do you think of someone coming up to you, their arm's blown off, they're holding it, they're coming up to you and they're like, oh my God, help me. What's gonna be their color code?
Yellow.
No, they're gonna be red.
Did they walk to me?
They walk to you.
Did they walk to me?
Yeah, and they talk to you, told you they need help.
With your
I put a tourniquet on.
So they're gonna bleed out.
I put a
So,
tourniquet.
throw a tourniquet on.
Put a
They will
tourniquet on.
And chances are, at that moment, because we triage on that moment, we don't predict, hence the problem with paramedics and nurses and doctors, because they're like, well, here in about 30 minutes, if I don't do something, he's going to be dead. We triage at that moment. What color would they be at that moment?
Green.
Quite possibly green. It's quite possibly that they are green at that moment. I throw a tourniquet, I control that bleeding, hey, go sit over there. Now, here's where you can get a little argumentative. Would they be considered a high priority regardless?
I've heard of
Yeah. So out of their greens, they are probably going to be a high priority out of that group. I'm not writing them off to be the last. Okay? But can they fit in that front seat of that ambulance? Yeah. Get your butt in that front seat next to the driver. You're going on the first rig out, but they were still green. But at that moment, they didn't require me to use resources to take care of them. That's what it's all about. What resources do I need to deal with you and you and you? If I don't need a resource on you, you're green or black. Okay? Now, can your patients die while you're treating them in our treatment area? Yeah. That's why we need to make sure we set up that morgue area. Okay? So we want to get patients who have deceased in our treatment area right next to the person who's alive, and they're watching someone dying next to them. Psychologically, what do you think they're thinking is going to happen to them? So try to move those patients to a designated area away from prying eyes and the other patients, okay? It's not a big deal at this point that they're not in the immediate area. Get them over there, tag them appropriately. We'll get back to them when we can, okay? But that's about the only time that you really truly need to move deceased patients a distance or further away than immediate. All right? All right, is all this making sense? It's a very simple concept, but it's hard to do in real life. You got all the emotion there, the chaos. Chances are you're in the middle of the chaos with everyone else running around. Okay? So the idea is to start creating that ripple effect, that chain of events to where you start taking control of the chaos. So if I start prioritizing patients and I start getting them organized and I start getting them moved to areas, I start controlling the chaos. And that's when the help can truly happen, okay? People running around all over the place, I can't corral them to figure out who's hurt and who's not. So I gotta start organizing. All right? So, anybody remember the structure, the command structure that we use to start setting this stuff up? Anybody remember the acronym? ICS. What it stands for? It's a command system, right? It's a system. All right, it's not a one size fits all, it's a system. All right, so somebody needs to take charge of the scene and take command of the scene, okay? 9 times out of 10, it's gonna be someone like me or someone on the police side. Got it. But until one of us can get there who's more fluent in it, it might be one of you guys in here, okay? It might be one of y'all, and someone needs to take charge and start organizing. All right? So if you're there, our first priority, what's our first priority? Assess our situation, make sure we're safe before we get hurt, right? Can't just run into a scene. Everybody remembers their good old clinical stuff. BSI, scene safe, yeah. Magic gloves, okay? Spirit fingers, everybody, jazz hands, whatever. Everybody's got their little thing when they were going through schooling. All right, so your safety first, and then identify what the hazard was. All right, so that you can start identifying what resources you need, right? And that includes patients, all right? Patients could be a hazard too, all right? That drowning person will take you down with them, okay? So patients can be a hindrance. So assess what you have and what you need to deal with. How many, you need lots of cops. I need fire, I need ambulances, I need, utilities, I need whatever it is. assess it, organize it, okay? Because just because a scene is happening down the street, it's just gonna relocate to the closest hospital. It happens every time, all right? Pick any type of active shooter event or mass casualty, natural disaster. The closest hospital gets just overwhelmed and they are useless. So you might have a mass casualty here right at the front gate of the hospital, and you have to start triaging and prioritizing and setting up that command structure immediately. So don't think, oh, I'm saving the hospital. That's not how it works. All right, everyone's coming to you. All right, so they're gonna be self-transporting, they're gonna be running, they're gonna be passerbys who have nothing to do with it, who are coming by, seeing people hurt and heard it on the radio. They see someone hurt running, jump in the back of my truck, and they're hauling people down. Cops are gonna be throwing patients in the back of their police cars, and they're transporting, especially if it's one of their own. Oh, they're not waiting for an ambulance. No matter what you try to tell them to find the ambulance, no, they don't care. Cops are stubborn, all right? I know that. A lot of my friends are cops, and they're very stubborn, all right? They're just gonna take their buddies to the closest hospital, not knowing that this hospital just got overwhelmed, and they're useless. But that's why we have to take control, and we have to start identifying. And we know that this hospital's, done. We start prioritizing to the other hospitals. We start diverting, right? But if you're not in the system, you don't know that, okay? So, clear as mud? Clear, right? Once again, it's all fun and games until it actually happens and, oh my God, the world's coming to an end, all right? So, the biggest thing you can do in the command structure is identify, right? So, that's where a lot of the flagging especially comes in, all right? Mark areas, mark big areas, clear, go excessive with whatever it is that identifies green patients here, yellow patients here, red patients here, whatever it is. Just organize it. Even if it's separate buildings, even if you make the first floor of this building, just shove all greens into the first floor, direct them all into there, and they're sheltered. Cool. They're controlled, they're corralled, they're contained. Cool, leave them there. Send a couple, EMTs, nurses, whoever, send them over there and start going through patients and dealing with those. Let us know what you need. The rest of us are gonna be dealing with the rest of the chaos, okay? So, mark it, okay? Let's see, what's the rest of the stuff? Pins, markers, whatever you need to write on patients, all right? Write on their head. So if you got the 4 colors, put a Y for yellow, big R in their forehead for red, do whatever it is, but just start coordinating, organizing, all right? And then make sure for your ambulances coming in that you have a nice conveyor belt type system. One way in, okay, and they go out one way. That's it. It's a nice system. They come in here, load up, move patients, bring them over there. Even if it's right here, right? Even if you're just putting patients to the other side of the hospital so that you can separate and get more control, then use an ambulance or some type of transportation to move them away. But have a clean system of whatever it's gonna be, okay? And especially for your people coming in. Oh my God, the world's coming to an end. Get everyone back here, and you got that recall roster and overtime's kicking in and mandatory, everybody back to your posts. Make sure they have a designated area that they report to, so that they're not getting confused with everything else because you're not getting anywhere into a parking lot. Make sure it's totally opposite end of something. All right, everybody reports here, check in, and we'll put you in the field and put you where you need to go. Okay, you're basically creating a staging area for your responders coming. All right. Okay, let's see. I love shooting from the hip here to get through stuff here. Okay, how am I doing so far? Everybody good? Questions? Okay. So the goal is to try to get a tag on them, so that you can start that flow of communication. Where that patient started at, where they're going, where they, are probably gonna end up. So you could try to get a tag on them, but don't think it's the priority, okay? I know you're probably going to argue with doctors and everything else saying, well, who's this patient? You know, what's their name? And, oh, I need information. It will happen, just not at that moment. It's okay. All right, the reunification process, especially when it's something I'm dealing with way out in the field and sending them to you, and you got that whole reunification process, it will take time. Okay, there's going to be confusion on numbers. I sent you 20 patients. Well, we only got 18. Where are the other two? It will happen. It will happen every time. En route, some doctor somewhere, charge nurse, something, redirected an ambulance somewhere to another hospital, something. It happens. Okay? I don't have control of that. I just know what I sent where on the initial, and that will start that process of reunification. All right? But don't think it has to happen at that moment. Oh, especially emergency managers. Oh, emergency managers are the worst. I need numbers right now. No, you don't. I'll let you know when you have the right information. Here it is. Okay? Don't let them bully you. Don't let those emergency managers do that.
Dang.
She knows it though, because she's getting beat up by everybody else who wants the information from her. All right? It's not their fault. They're getting beat up. Where's this? All right? They wanted to know the status of everything. All right? And when you're not in the field, and you're stuck in an office or somewhere, you're glued to a phone or a text or a computer, an email, and that's the only way you're getting the information. And you're sitting there waiting. 5 minutes seems like an hour. And you're like, I never got my update. Well, it's been 10 minutes, and since then we had an explosion here. This guy came running through here, screwed up our scene. We had a car break through the barrier over here. We're working on it. So, don't let them bully you. Deal with the chaos as it happens. Just start the control, start the process. It will get there. It will catch up. All right? So, I do like the slap bracelets though. They were pretty cool. They just what? What do you think the problem is for something like this? Well, of course they can take them off. They can do the same thing with the tags. They can be like, ooh, that guy who had a red one, I'm gonna make red. I'm red, I don't know why I'm over here. All right? But these are very limited. You only have, maybe 20, 30 of these in your little pouch, So that's a problem, So whatever your system is, yeah. That's why I like the flagging, like this stuff. These little patches with flagging. This works great for ramp. So ramp only has 3 colors. I think we've pretty much covered most standard triage. So we'll cover ramp just a little bit. Ramp has three colors. They got rid of the yellow. They got rid of delayed. Because that was the most confusing part of all triage, is determining if somebody's a yellow. It's very simple for me, to walk or not walk. But majority of people out there were labeling patients yellow when they were greens or even reds. And they were like, yellow. They're kind of okay. So in ramp, they got rid of it. They got rid of yellow. So all you have is the green, red, and black. So they simplified it even more. That's why they decided to go to ramp. It's even more simplistic. They got rid of the respiration count, and it's just, are they breathing? Yes or no. Pulse, yes or no. And conscious, yes or no. Then on that, they give you the opportunity to kind of be subjective with it, and they let you say, you know what, he's stable enough, he's agreed. Or he's not stable at all, he's gone, and I can label him red. So they give you a little more leeway in that it's not so exact. I'm an analytical guy, so I like exact. I will count your respirations. 30, yellow. I will do that, but. So that's where these little fanny packs are great because I can triage 100 black, 100 red, 100 green easily with this one pack. I just tie it on an appendage and go. All right. So, and they can't replace it. They can't rip it off and get another one because I have the only one. So obviously you didn't get triage if you're missing one. Even if you ripped it off, I'm just gonna re-triage you again. Nope, still green. Okay. So But that's generally what's going to be coming down here shortly with the ramp. It's just, if you can understand basic start triage, you'll grasp ramp even quicker, okay? Nothing else has changed, all right? Everything else I've been talking about, it's still the same stuff, all right? They just simplified it a little more to stop the confusion in the middle of panic, all right?
So from here on out, then if we had an MCI today, and we started only saying 3 colors, it's because of ramp. So then we need to start, like, CDP still trains start, so we still have those from a hospital emergency response. We have to teach until they tell us otherwise, but we need to at least be able to get the word out, because we're gonna be doing that secondary triage. Once you
Yes.
guys are getting them to us, or we are getting them from their own vehicle,
Yep.
whatever, that if we see that we should know that, yes, not everybody is really red, but they got rid of yellow, so it's this or this, but some of our greens may be more severe than what we're used to seeing.
Which is no different than what you're dealing with now. It's still no different.
Right.
Remember the high priority green we talked about? Still no different.
Okay.
Literally, they just simplified the coloring. You're still gonna have your high and lows within each category, okay? So, don't get so wrapped around this, but yes, get the information out, start getting familiar with RAMP. Rapid Assessment, Mentation Perfusion, or, I can't, it's acronym something like that, all right? Now as far as, we kind of talked about it a little bit, the ICS structure, I would be drawing right now and stuff, you know, so I'm having to kind of skip a little bit. You got your incident commander, okay? What do you think is right below them in the field setting there? Anybody remember?
Liaison.
Operations. Operations liaison, that's a secondary thing. Safety officer, like that's my position. I'm health and safety for Fort Cards Fire. I'm a secondary position. All right. The initial is getting control of that hazard, getting control of the scene. All right. If we have enough people to where I can fill my position appropriately, then cool, we're doing good. But the biggest thing is command and operations. Somebody who's dealing with the resources and somebody who's dealing with everything that's happening in the field. Okay. Those are your two priorities. And granted, it might be the same person doing both. All right. But as soon as you can get someone in there to help alleviate some of those responsibilities, that's what you want to do. All right, hey, you, I need you to take over operations for me. I got to deal with the 30 resources I got coming in right now. Okay, cool. Let me know what else you need. All right, so those are kind of your two big main ones. I know hospital ICS is you know, they've got their own flow of everything, but for the most part, it's the standard level, you know. Okay, so we got that. Okay. All right, let's review real quick. What type of things am I looking for as I'm coming up to a patient to triage?
Ambulatory or not.
Right, walking, not walking, breathing, not breathing, conscious, not conscious. All right, those are everything that I'm looking as I'm walking up to them, right? Real simple stuff. And then bleeding. You know, do I see some major bleeding happening as I'm walking up to them? All right, because as I'm walking up to him and they got that guy with his arm blow off and he's holding it on and it's just dangling away and he's just like this, I know I'm already gonna be grabbing for that tourniquet as I'm talking to him. Hey, yeah, where were you? What were you doing? Okay, wow, that looks, yeah, keep holding that. Did you find your arm? No? Okay, walk over there. Okay. It happens. I can't tell you how many times I'm trying to find like fingers that have been blown off and you're like, has anybody seen the finger? I swear I'm missing a thumb still. Anybody? And you find it up in a rafter or something. How'd that get up there? And you know, it happens. That's the world we live in, all right? We're medical here. So, I don't know, I love doing these types of conversations amongst other people that can relate to me, and I don't feel bad talking about this over dinner. All right? So, vests, all right? Vests are great, all right? It's a non-verbal way to identify people, all right? I know that if somebody's got this vest on, you know, I don't even care if it doesn't say anything. I know I can point people and say, go to the orange vest. They're in charge. Go to them, give them the problems, All right? As soon as I can identify someone, I'm gonna start identifying, and the nonverbal, the better, okay? If they say something, cool. As you start getting multiple people, right? The problem is, in a crowd, it's hard to read best. Like, what? I can't read that. Is that operations or is that liaison? I don't know, you know, and you're having to, because I guarantee you in a true mass casualty, people are running, people are crowding, you can't see people, okay? So, different colors are better. So you don't have to read stuff. Green vest, orange vest, yellow vest, go to this one, okay? It's simpler. All your triage team might be all orange vests. I can see them out there in the field and be like, oh, there's triage team 1, there's another one, there's another one, all right? Cool. Covered all that stuff. That's questions so far. Okay, we feel comfortable enough to practice this. She's like, yeah, let's do this. Okay, cool. So I'm gonna split you up. Yeah, we're even. Sweet, 4 and 4. This group, that group. This group's gonna be patients first. You guys are gonna be triage teams. So go ahead and wait outside. I'm gonna get them going. They're gonna be your patients. And you'll have to use your imagination a little bit on these. I don't have moulage kits or anything. All right. Okay. So, I haven't seen you. Cool. All that kind of makes sense. I know it's quick, I know it's dirty, I know, I get it. I've taught workshops for like 8 to 10 hours before on all this stuff. And we really get in depth and we really go through the different commands and responsibilities and yeah. The state paid me to go across Colorado and I taught these workshops. Oh no, I got paid. Trust me. I'm like, okay, cool. All right, room and board, per diem. Okay, so we don't have, these are gonna be pretty simple, obvious things since we don't have the whole moulage shit. So, I need you to be my confused patient.
Oh, good.
You're
I
gonna-
can do that
You're
well.
gonna you're just gonna be running around, and it's gonna be that whole, they're in shock. I love that term when you see that. They're acting crazy because they're in shock. You're gonna be that person. Okay, you're gonna be the one. I don't care what anybody tells me, where they tell me to go. You have to help my friend. You have to do this. No, you don't understand. You have to help them.
Right.
See what they do with it.
Sure.
For you, let's go with simple, unconscious. All right, so just lay somewhere. Okay. For you, I need you to be the fast breather. Try not to hyperventilate yourself. Wait till someone actually comes up to you as you see them lock eyes on you. Just keep it simple, but don't. You start feeling woozy. Don't worry about it. It'll correct itself eventually. All right. And for you, so we did breathing one, we did unconscious, we did. Yeah, but it's hard. It's just hard. It's hard to do that. So for you, you're just gonna be the I can't walk person. So you're gonna have massive back pain. You can't walk. You can't move your legs. You're gonna be that person. Okay. So cool. And you primarily be focused on her, but deal with everybody else. But try to. No, you don't understand, my friend. All right. I want to see you win that Grammy.
Okay.
Okay. All right. That's what I want. The Oscar, the Tony. I want you to own that character.
Okay.
All right. All right. So everybody good? Let's kind of spread out in this area right there. I'll bring them in here. They got to deal with that.
Jess, do you wanna turn the camera around this way, or do you want us to come over this way?
Oh, you got the camera going, so whatever kind of works for you. Okay. All right. I'll give you just a couple minutes and then. Okay, I'm about to throw this. No one talk.
It's not gonna move much, so it's not gonna be super visible.
They're just gonna let themselves in.
I don't know that they can.
Okay,
That door is always the
Yeah.
worst.
He's creating a fire hazard.
Fucking yes. You're killing me over there.
Are you setting up this scene?
Right, green on the right, red on the left.
Oh.
Stand over here.
Are you my
And you
friend?
walk, let's stand over here.
Lady, are you my friend? Where's my friend?
Can you hear me?
Oh,
Stand
my
up.
friend. Oh, are you my friend?
Don't move me.
Right here.
Don't move me.
Ow.
That hurts. That hurts.
Are we moving him or just tagging him?
Wake up.
This is a red.
She's
I
black.
need my friend.
What?
She's black.
Come on, let's go.
She just
You're not black.
scared me into feeling better.
She's green.
She's green.
She's red, she's not walking.
Ow.
Her back, so she's gotta be yellow.
You have my friend's shoes. Take
Oh.
off your shoes.
But she's not fast. She can't walk.
This
This one,
is my friend's
this might be a
shoe.
red because she's altered.
No, here's my friend.
She's altered.
laying down, she's sleeping.
She's green, but she's moving back.
No, she's altered.
Wake up, friend.
She can't be green because she's altered, right?
Wake up.
Correct? She can't be green because she's altered.
She's talking.
But she's
green.
walking.
Yeah.
So the walking is green.
I thought you were
I'm talking
She
about
is not following.
and she's
So red, yellow,
red, yellow,
red,
black.
and black.
Oh my God.
She's
Where's
red.
my friend?
She's
Oh.
yellow.
Whenever you're ready, man, we know what you got. What's going on?
Yeah.
Oh my God.
She's red, yellow,
You know,
black.
we have lots of day green, you're not
Here, let's just stand over here and you can help me with her.
No, that's not her. But she has her shoes.
Two reds and a black.
Yeah, I need
Oh,
those
you got
shoes.
more patience.
Those are friend's shoes.
I like those.
So even in a small room, you got numbers. So imagine on
It's
a.
not my friend.
She wants to help her friend.
Yeah.
What's your name?
Yeah,
Yeah.
I don't remember.
Yeah. Yeah.
Terrible,
Okay.
terrible
Alright, so what you got?
terrible.
Oh, red. Are we doing yellow?
Yeah.
Okay, red,
Do what you-
yellow,
do what you got.
red, and I didn't assess this one.
She's black.
Black, okay.
I was breathing.
No, you weren't.
I'm not dead yet.
She wrote you off. See you.
I checked her pulse. She was not breathing. I said, hey, can you hear me? Can you hear me? She didn't know she's black.
So she's a red. She was unconscious.
She had a pulse and she was breathing.
No,
No,
I
okay.
checked. No pulse.
No pulse.
Wow, I saw my pulse. Wow. That's okay, because she
She's a great actress,
I'm
right?
screaming and she's
Wow,
like,
impressive.
I want to know how
You
you
know
shut that down.
what? The Grammy and Oscar go to you.
thank you.
Yes.
I appreciate it.
Pretty good.
Wow. Wow. I mean, I've heard of method actors, but you.
You can slow your pulse, sir. Are we?
Yeah, I started saying, no.
I only started laughing when you started. I was like,
So, what was your initial plan?
To try to like separate and then, you know, start treating at that point after.
Okay, separate just your two people.
We didn't ask for blood though, so.
Yeah, like I said, on the it's kind of hard to find. So
I know.
it was pretty simplistic.
Simple, yes.
All right. So what was how'd your team divide up and conquer? Did you give them any direction there, or did you say just go in and triage?
Just go in and get it,
So, word to the wise, get better direction on the system you want to use.
yeah. Okay.
That's why, because I was questioning yellow.
Mhm.
Are we doing yellow or are we doing?
That.
Right.
Well, not only that, but also how you're going to approach it. If you know you're coming into a closed-in area, am I starting on the right hand or left hand?
Yeah, because we split it up.
Clockwise, counterclockwise? Or is it geographically broken up? Okay, you take everyone in this room, you take everyone in that room. Okay? So whenever you're coming into it, that's why it's good to have someone in control who's like, okay, you're coming in here, you're gonna come here, when you get done and meet, come back to me and report. But right now, you kind of went in and you were like, yeah, I'm just gonna go this way, I'm gonna go this way, and y'all were double triaging, right?
Well, it was nothing else for me to triage if you're black, so I just kept it moving. That's it, right? What are you supposed to do?
No, but you see how,
Yes.
make sure you have a system, not just necessarily what system you're using, like, hey, make sure you use a good start triage, whatever it is. If you know you're unsure, then cool, but also how you're going to do it. All right? So I didn't want to say anything because I wanted to emphasize the point.
Right.
Okay, cool. So you two, you're done, and she was definitely red.
So, do we have a red deal?
Okay, so she was what?
I classified her as a red.
Why?
Because she could not get up.
She couldn't get
was
up?
in pain.
Was she breathing?
She was breathing.
How fast?
Fast, like more than 30.
Right.
She was,
So based on just breathing right there as you're
Right.
walking up.
yeah.
So it didn't matter if she could walk or not walk.
Okay, yeah. Well, I
That
knew
was,
she
that was
was
irrelevant
breathing
at that point.
fast,
Right.
and then I
Because
didn't know what else was wrong.
I don't need,
but-
remember, 60 seconds stops with
Right.
treatment. So if I don't have to go through the whole thing and already got a
Mhm.
color,
Yeah, okay.
cool, next. All right, all right.
Knew she was breathing.
Her?
She couldn't walk,
So
but
what-
she was, her mental status was there and she was
Yep.
breathing fine, so I marked
So
her as yellow.
yellow or, you know, red, depending, because she would take resources. If we were
Yes.
doing ramp, she would be a red, she would be an extremely low priority red.
Right.
Right?
That's why I classified.
But it would take resources to deal with her.
Mm-hmm.
She couldn't walk on her own. So in ramp, so you got a little more leeway to where,
Right.
you know, you're just red, but I'm gonna stick you over there, I'll deal with you in a little bit. Okay? All right, what about this one?
Well,
I
it,
said she-
yeah,
I said
she said she was
red.
black. She was dead.
So she was
Sorry.
definitely red. She was just
She
unconscious.
was unconscious.
The
Okay.
reason why I said that was because that when you have a person that's unconscious, you have to try to stimulate them, see if they will move. So when I touched her and I was slapping and I was yelling, no response.
That's unconscious. That is the clinical definition of unconscious. Not responsive to pain, not responsive to verbal, that means unconscious. If they respond to any of those things, then they're not unconscious. Their response to pain, their response to verbal, their response to something else. Like most drunks, if I come up to a drunk and I stern problem, which I guess you can't do anymore, but you can't do that, or if I yell at them, hey, wake up, and they go, and they never open their eyes, they're responding to pain or verbal or something, but they're not unconscious. That person who got TKO'd in a boxing fight, and you come up to them and you're like, hey, and they're just linguini, they're out, they're unconscious.
So how was, well, okay, never mind.
Now, are you breathing or not?
I'm just saying red.
Yeah,
Yeah, because she was breathing and had a pulse, supposed to.
but yeah, she just got knocked out. But it's gonna take more resources to deal with her. Especially the unconscious could be underlying, you know, factors of something, other major internal bleeding, like you brought up earlier, things like that. She could be unconscious due to lack of perfusion. So she could be totally crashing. Hence red, she's gonna be priority, we're moving on. But as soon as I walk up there, hey, okay, well, she's breathing, red, next. I don't see any major bleeding. Could be internal, could be, you know, a TBI, could be multiple things. But I know she's a higher priority. And I don't need to go any further with it because I don't have time to deal with it. I just know she's a priority and I did my job, I'm moving on. Okay, what about her?
She either has Alzheimer's or Alzheimer's. And I don't mean that cruel, but
No.
you can't tell.
Did she follow any simple
No.
commands?
No.
So, once again, mentation,
Mm-hmm.
simple commands. That's why I came up to you right at the beginning of class and said, hey, can I check your pulse? And you're like, yeah, she follows simple command. That's all I care about. Hey, you go over there. And they listen. Or they argue with you. No, I can't leave.
Well, that's what
Because
she
I'm over
did.
here.
She says, I gotta find my friend, and you says, okay, wait a minute. And she said, no, I gotta find my friend.
Did she acknowledge you? Or was she out?
She acknowledged her. She
Well,
acknowledged
she,
her.
So it's kind of subjective, right?
she didn't know her name.
Mhm.
She was going to someone else to find somebody. I mean, just, she was altered.
Right.
Mental
She,
stuff.
either way, she wasn't listening to you in any way, shape, or
Right,
form.
no.
So what color would she be?
Red.
Red.
Yeah.
Right? didn't follow some commands, she's out of it. She could be shell shocked, whatever. She's an issue. I have to take resources to deal with her.
Right.
It's all about resources.
Well, what type of resources would you do? What would you do being difficult?
Cops.
You can tell difficult from,
Altered.
really, because when they're difficult, they argue back with you and talk to you, but she was more concerned about her
She was
friend.
looking for her friend.
But she may
It
not
was
have
a
a
major
friend.
catastrophe.
Either way, you're thinking way too deep. into it. You're getting way too deep. Remember, this is simple. She didn't listen to me. She didn't follow any of my commands. She doesn't do anything. Bam, red, do mentation. And if she becomes combative or an issue, then if I can't give her a direction to help, that's where cops come in. Hey, detain her. I don't have time for her.
Mhm.
And we move on.
Until she gets to the hospital.
Or in our scenario where we're secondary triaging, if she's doing that, until she's ready to get naked per se, because she's ambulatory, to go through the line, she's gonna sit there until she can do her thing.
Or doesn't,
Or-
or go crashes.
Yeah, or changes status.
Something's gonna happen.
Yeah.
One way or the other, she gets better, she gets worse.
Yeah.
Something's gonna change. And then you'll know, and you'll have a better idea which direction to go. But this is a mass casualty. I don't have time. I don't have time to figure everything else out, which would be a high or low priority.
That's low level.
I would put her, yeah, I'd put you slow because you are moving, you are talking.
She's
you are
breathing, she's not bleeding out.
You're moving real
But
fast.
she's
and your
disruptive.
breath is
Once again,
Yeah.
but not after I handcuff you.
Yeah.
Once I honk on you and put you over
All
here,
right, Tim, go for it.
I got you.
That's what I mean, you could be an Alzheimer's patient
Yeah.
walking in, or
Yeah.
you could have a head injury.
Yeah.
So,
Yeah.
once again, how many resources does it take to deal with you?
Right.
That's what it's all
Yeah.
about. Okay, so we're gonna bring in the other half of her team. Same scenarios, play it up. You learned how to make it a little more clearer for them. So don't listen to acknowledge them at all. Make it easier for them. But everybody else, you're doing good. You can slow that pulse rate down again, man. You're awesome. Okay. So remember, so hey, man, try again with one more breath. You can go way over here if you want. You know, just watch. Go really fast. Oh, no, remember, it's down in very soon. Don't get even, that's the problem with, as you get more medical knowledge, man, you start looking at different things. You know?
And they're always gonna get re-triaged.
Over and over.
That's true.
Things you do.
Wait till they get into a treatment area because you don't have enough ambulances or stuff to move people to deal with them. They're gonna get triaged again. Again. They're gonna catch, the trends, the trending patient. They're gonna catch it.
Did you see that bad accident in Alabama where
Ugh.
the
Yeah.
kids were killed?
Is that recent?
Like yesterday?
Okay. Ready.
Is this my friend? You know, friend?
Ow, don't touch me!
I can't find my friend.
Ow.
Oh my God.
Ow, are you gonna come over here and help me?
I
Ow.
don't know where my friend is. Are you my friend?
Ow.
No.
Are you okay?
Oh, I have to find my friend.
You have to find your friend?
No,
Okay.
don't touch
You know what?
me!
If you come over here,
I
we'll
want
help.
her shoes. She
I
has her
think she's
shoes
right over
on.
here and we'll help you find her.
Oh, where is she? Where is she? Where's my friend?
What's her
My
name?
back
In
hurts!
fact, okay, are you able to stand up?
No! Help me!
Okay,
Ow!
alright, so she's not.
Ow!
Can you move your toes?
Oh no!
Red. She's black. Red.
Okay.
Okay.
Okay,
So
when
we
you
have
got-
3 reds and a black on the scene. We're gonna need an ambulance to transport. We have an altered mental status. We have a lady who's probably paralyzed and a lady with abdominal breathing.
Yeah, God.
At least she didn't try to take my shoes this time.
And we're green with.
I'm sorry. God.
loose one moving around, and then the one, yeah.
Was it their ride or my ride?
Ooh, God.
'Cause I'm gonna my ride.
Yeah, you did. Like,
Sorry.
that's okay. But I think it went better than before.
Yeah, no, it seems smoother. Okay, all right.
You're like, not really.
You learned lessons, you found new problems, right? You corrected, now, so, obviously there was some confusion on the
Yeah.
team.
Mm-hmm.
You went to the patients,
Yeah.
right? You went to his, right?
Yeah. Mm-hmm.
Okay, so, what about the patients that were sitting like this and not like this? Would their right and lefts be different? If they're in the same position as you? So can you always say, I'm using a patient's right or left in a scenario like this?
Well, no, because they'd be scattered all over. Yeah.
So, whenever, that's why I
Yeah.
heard her say it, and I was like, I know what direction she was going with, and she wanted to go with her right.
Yes.
Yeah.
The one I
So as you're coming into the scene, geographically, this is gonna be the right side, this is the left side. So
Okay.
you technically were correct, she was wrong, technically.
But you
Because
said,
I figured she's like, we're gonna go right from left, so I was like, okay, well, there's no one to the right, so I'm gonna move this way to the left. Right?
So there was confusion.
You said
In
you're
this
going
simple
into the
scenario,
scene from right
There
to
was
left.
confusion not only there, but also in numbers,
Mhm.
right, of what you had. How many did you say of color codes?
I had a black, a red, and 2 green.
Black or red and 2 green. What did you have?
I had 3 reds and 1 black.
Alright, so as men, you got 2 different people here with 2 different, categories and numbers.
Yeah.
Which one's correct?
yeah, you don't know because you weren't out there doing it, so, but that's more
Right,
correct.
so
Yeah.
they would be getting marked in some way as
Yeah.
they went through triaging, so
Yeah.
you wouldn't be double triaging.
Right.
But you could see how he interpreted them differently than you.
Right.
And this is simple of a scenario.
Yeah.
It's very, very simple scenario, but
Yeah.
you see the confusion. Just in the direction, just how the teams were splitting up. Because if you don't have a clear direction of how you're dividing the scene up, then you're gonna miss patients.
Mhm.
You're gonna skip over them. You're gonna get duplicates. You're gonna get all kinds of weird stuff happening. That's why you need that clear system and someone in command and that clear communication of what the expectation is. Okay? And if you're confused, ask. Be like, wait a minute. I'm going this way. He's going this way. Which way did you want me? Hold on. All right. So, what do you guys think? Being the patient's point of view.
He made me a black. I was like, wait a minute, but she came back and changed me to red.
Okay. So why was she
I was
red?
good with that.
She was red because she had agonal breathing. She was alert.
Was an agonal breathing?
I guess not agonal.
What
but-
anybody remember what's agonal?
Like,
Slow.
So
Very-
fish out of water? The asthma patient.
Yeah.
She wasn't like gasping for air. She just had she was breathing really fast.
Really fast and rapid,
Yeah.
right?
But I mean, it wasn't like she was unconscious. Like she was awake, but she wouldn't answer my questions.
Because she was trying to struggle to breathe.
Probably. So I
So
I
red.
labeled her as red.
Yeah.
I labeled Jess as red because she couldn't get up and walk.
Now,
So
which system were you using? Start or ramp?
Oh, I don't know.
Because if it was ramp, you would be correct. If it was
Okay.
start, she would be green or yellow.
Yellow.
Well, yellow because she's stable,
She's stable. She
but
just
it takes
can't walk.
someone to move her.
Yeah. Gotcha.
So it's another resource. So therefore,
Okay.
level above green.
Okay.
But ramp, she would be red because I have to dedicate resources to deal with her.
Okay.
Okay, what about this one?
She was black. She wasn't awakeable. She wasn't breathing.
What'd you get?
I considered her breathing only because I knew she had to be breathing.
She was,
I guess
yeah.
I didn't put myself in the
No,
scenario.
she was breathing.
I was
Yeah.
wrong.
It was that's why, I didn't make any tricks here.
Yeah.
She was breathing.
Yeah, I had her red.
Uh-huh.
Yeah.
Based on what?
Unconscious.
Unconscious. Same?
No, I labeled her black.
You went black?
Yeah, because I felt like she was unconscious, and she didn't really have rapid breathing, and so I figured she was just playing dead. So
So you made some big assumptions. I know she's breathing, she's got a pulse, she's just not awake.
You gotta be quick, right? And you can't make someone stop their pulse either. So she didn't look like she was really breathing, so I labeled her as black.
Alright, so red, just unconscious,
And you goes too.
Right? She is good. She is good, man. The way she slows down that pulse rate breathing, man, she's good. All right, but Red, just based on level of consciousness, all right? She was unconscious.
Yeah.
Red, all I care about then is she breathing, right? I don't even have to worry about the pulse at the point. I just, as I'm walking up to her, she's not waking up, she's breathing. Do I see any major bleeding?
Okay.
That's red, I'm moving on,
Okay.
all right? Or possibly black if she's not waking up, not breathing, no pulse, you know, all these, okay, then black and I move on, okay? All right, what about right here, our Oscar winner right here?
She's red.
Red?
Letters green.
Get it?
Oval,
Right?
although altered, single though altered.
Right, could she follow any simple commands?
No.
Right, so is the mentation there in any way, shape, or form?
No.
Could be multiple things going on with her.
Yes.
So what color would that
She
be?
was looking for a friend.
I said.
Right, but she obviously wasn't paying attention to you or caring about you, right? Or listening or trying to, she was not following a command.
I said red.
Right, red,
Yeah.
right. But you not necessarily would have been wrong in that type of situation to just label her green, because outside of a cop maybe hog tying her and sticking her somewhere where she's out of the way,
Yeah.
it doesn't really take a lot of resources to deal with her, but there could be something going on. So there's a little bit of subjectivity on that one, but she's definitely not listening to a simple command, so you're not wrong with labeling her red.
And Mike, with the way we've been teaching with CDP, their algorithm says, can they walk? Yeah, they're green. Stop here. So you could definitely get away with green there, but then on reassessment.
Yeah. All right,
And I killed me.
and to our actors here, they're great.
It's like she's out.
Okay, so,
Yeah.
all right, so do you guys feel like you want to do some more, or is that kind of, it's hard to really fake this without any like true, bleeding
Blood
props,
guts,
and
I
then,
mean.
yeah, we're pretty limited to kind of these scenarios, so how do you guys feel? Do you think you got a kind of a better feel for triaging? Or do you want to go through some more, a different part of it?
Do you guys want a sword? No, I feel like talking through it was helpful. Okay.
Yeah.
Yeah, I mean, you guys have the best education being the patients and seeing it, dealing it, seeing the problems, seeing how the communication goes. You saw the confusion on, she tried to get better, and she's like, I got this. Man, I'm gonna give them commands, I'm gonna give them direction. Boom.
It's hurting
She was
cats.
like, we're gonna assess the scene from right to left. I'm like, okay. we're
Cool.
okay, right to left.
Simple as you can get, and there was confusion. Right? So, don't always take it for granted, and don't be afraid to wrangle your teams and go, hey, no, clockwise, all right? If you needed a different word than right to left, be like, okay, that's not making sense to them. Try this, try a different approach. But, does everybody take something away from this? Everybody kind of,
Yeah.
Yeah.
okay. All right, don't be afraid to put on these little drills on your own. Just come up with different scenarios, play around with it. This did not take any effort whatsoever to just come up with a scenario like this and play it out. All right, just try it out, practice it, play it out, and if you got questions, I'm a phone call away. All right, as we get further into the ramp, we'll be putting on a lot more education on it, and we'll be getting a lot more hands-on with it. My goal is to get the state to pay me again and go around the state teaching again. So we'll do workshops, we'll do all that kind of good stuff. Okay. But questions?
So with red to black, are you really looking at, like diagonal reading, obviously for black, are you looking at pulse at all? Checking a pulse?
If once I get a color code, outside of any treatments, I don't need to go any further.
Okay.
I don't care what their distal pulse is. If they're doing agonal breast, chances are I'm not going to have a distal pulse.
Yeah.
So there's no point. I've got a major triage criteria. I hit one.
Okay.
Then it's okay. Any major bleeding? Do I have to throw in an OPA or a chest seal or something else? Whatever's in my bag of tools. Do I need to treat them with something to keep them wherever they're at right now or get better?
Yeah.
All right, and that's it. Once I get a color, I'm good.
And then they are multi-triage, I mean, like, said that they go back, once you get initial triage.
There's
they
secondary
go
triage.
Back.
There's tertiary triage.
Yes.
There's
So it's
triage
not
in the
like
treatment areas.
If they're green and they crash, somebody's gonna triage them at the end, but
So
it's.
here's one rule I kind of forgot to mention. you never downgrade a patient. Okay? If they were red, they were red for a reason. They stay red. They can change priority level within that red. Like, yeah, you know, I was basing your red off of breathing. You seem pretty chill right now. You're low priority. Okay, but never, you can upgrade, just never downgrade. Okay, they can go from red to yellow to red, or green to yellow to red, black, or even skip them and go straight to black. You can do that, just don't go back down. Okay, if you label, and don't be afraid, if you label someone expectant, you got that fish out of water patient laying over there with a harpoon through his chest, and you're gonna die, buddy. I deal with all these patients over here, and I come back, and that person is still there going, how are you still alive? Okay, well, let's go. We can now deal with you. The mass casualty has been mitigated enough to where now I can deal with this patient. I have enough resources. So don't be afraid, like, no, I live with you black. You're gonna die. If you have the resources at that point, you're not in a mass casualty scenario anymore. Deal with every patient.
Right.
Okay? So don't think just because I live on black, that's it. If it's just I'm not dealing with you right now. That's what that's saying. If they're still alive when I come back around, man, you're stubborn. Man,
We all know a few people
yeah,
like that.
yeah. We've all been there, right? How are you alive? Seriously, you've got this, and this going on with you, and you're still alive. All right, cool, man. You want to live? Got it. Let's go. All right. Packing ambulances. We can't. I don't know. I know you guys aren't going to be dealing with a lot of the true field stuff, but if you have to pack ambulances, pack them. I don't care what AMR says. I don't care what that paramedic says. Like, no, I'm only taking one red. No. No. I'm gonna shove that green with the missing arm in your front seat. I'm gonna shove maybe another high priority green, maybe a yellow on the other bench. I'm gonna fill your ambulance to get them where they need to go. Okay, if this hospital starts crashing because of being overwhelmed, you might have to start reassigning patients to rigs and getting them transported. Pack their ambulances. No matter, I've had paramedics argue with me on their rig and saying, no, I'm not taking more patients. Yes, you are. Boom, boom, and I just start loading them and say, you better get going. All right, so those kind of pointers. But yeah, other questions? No? Okay, cool.
Thank you.
Once again, I'm a phone call away. All right, I'm gonna go deal with my daughter's birthday.
Aww.
She turned 4 today. That's why they were at the zoo.
Aw. Thank you so much.
Thank you.